Hi, this is Piyush Bhargava, and I have a few interesting cases to share with you in this short video. Our first case is a 56-year-old female who was being evaluated with a whole body FDG PET-CT. Here's the rotating image, and on the rotating image, we find that there is abnormal uptake in the left axilla and in the region of the left shoulder. These findings correspond to hypermetabolic left axillary lymph node seen here on the transaxial fused PET-CT image and here on the coronal fused PET-CT image. And the uptake that is seen in the left shoulder right here is an ill-defined focus, and this focus is also localized on the fused axial and coronal PET-CT image to be in the deltoid. So a couple of days before their FDG PET-CT scan, this patient was given a COVID-19 vaccine, and we see uptake, which is inflammatory uptake at the site of injection and also in the left axillary lymph nodes secondary to COVID-19 vaccination. Thanks to Dr. Mayer from UTMB for providing this case, and here is a good reference article on FDG avid axillary lymph nodes after COVID-19 vaccination. Our second case is a 48-year-old female being evaluated for right upper quadrant pain. The image on the left shows a grayscale image from the right upper quadrant ultrasound. We're looking at the gallbladder in the long axis, and we see the wall echo shadow sign, and there are multiple gallstones which are shadowing, and so this patient underwent a laparoscopic cholecystectomy, and because of continued abdominal pain after their surgery, a HIDA scan was performed. And so these images are from the HIDA scan after laparoscopic cholecystectomy, and we see uptake in the liver and excretion into the biliary system, and there is a bile leak. Bile leaks from right here, the site of the cystic duct remnant, into the right lower quadrant paracolic gutter and extending into the pelvis and also moving superiorly around the liver. So this patient has bile leak post-cholecystectomy. And so this patient underwent an endoscopic procedure, and we have an image from that procedure on the right where an ERCP was performed and a plastic stent was placed in the CBD. Here's the proximal end of the stent in the left-sided bile duct, and then it courses through the CBD, and we see the distal pigtail in the second portion of the duodenum. So this patient had bile leak that was treated with ERCP. Here is a good reference article on endoscopic management of biliary leaks after laparoscopic cholecystectomy. Our third patient is a 69-year-old female who presented with shortness of breath. And so a VQ scan, actually just a perfusion scan, was performed because we are not doing any ventilation studies because of COVID. And so a perfusion scan was performed using technetium-99m MA, and we see multiple images here showing that there is no activity in the left lung on this anterior image. There is no activity in the left lung on the posterior image. And so what can be the causes of why there is no perfusion to an entire lung on the left side? And so when we compare these images to the patient's chest x-ray, here's the left lung. It is aerated, although it seems like the bronchovascular markings are prominent, so there may be congestion, but there are no opacities, pleural effusion, or pneumothorax. And so the answer was evident looking back in the patient's chart, their prior imaging studies, and so these two images are from their CT scan showing patent left superior and inferior pulmonary vein and their branches. And then this patient underwent pulmonary vein ablation for treatment of atrial fibrillation, and after that procedure, there is occlusion of the superior and inferior pulmonary veins secondary to thrombosis. And because of that, we see this pattern on the VQ scan where there is no perfusion of the left lung seen on the anterior and posterior and the other views. And so this is a rare complication of pulmonary venous thrombosis secondary to AFib ablation of pulmonary veins, and only a few case reports are currently available in the literature. Some of them are shown right here. Thanks for watching.